a patient population or a cancer patient population that I'm seeing in the community that's being deemed as low risk when that's actually not the case is actually survivors of childhood cancer. This patient population, especially if they've received radiation to their chest, is up to 10 to 20 times more likely to have these conditions in their 30s and 40s, which is almost unheard of to some degree in the general population, compared to their age-matched siblings. And so when I see these patients and I find out that they're survivors of childhood cancer, have received a toxic chemotherapy called anthracycline or radiation to their chest, I treat them very different than if they had not had those things or received those things. I want to know if they have any evidence of something called coronary artery calcification or plaque in their arteries that could increase their likelihood of an early heart attack. I would have a lower threshold to treat them with a medicine called a statin, which historically lowers cholesterol, but it also has something called pleiotropic effect, meaning that if plaque is present in the heart arteries, it stabilizes the plaque, it has certain type of anti-inflammatory properties, etc., to also minimize the likelihood of an early heart attack. So this patient population in particular is ripe for early what's called primary prevention or preventing cardiovascular disease before it happens, but they're not being treated as high risk as they actually are. So that's where awareness, not just on the healthcare provider standpoint, comes in, but also from the patient standpoint, knowing that they're at higher risk early on and reaching out to certain providers who have an expertise in the field that could help long term.